Dr. Gupta, I'd like to get you in here. We spoke about how this could perhaps is a sexually transmitted disease, but who are the most vulnerable to this disease, and what happens to the people who are already infected? And if anyone comes in contact with them, what happens to them, how vulnerable they are, and also what are the precautions that one can take in such circumstance?
Good, great question. First, I would like to correct one thing, that incubation period ranges from 5 days to 21 days, minimum 5 days. Means symptoms can appear as early as after 5 days of the exposure to a infected person. And after like 21 days, the minimum 5 to 21 days, they can appear in between any day. And the symptoms are normally fever, swollen glands, rashes, blisters, and crusting. And it can persist 2 to 4 weeks. In natural history, normally it disappears within 4 weeks of exposure, and patient becomes ineffective. If we talk about the complications or the more vulnerable persons, definitely children, immunocompromised patients, pregnant ladies, they are at high risk. These children can develop septicemia, encephalopathy, they can even develop blindness, severe eye infection can be there, even pneumonitis can be there, ARDS can be there, even in pregnant ladies there can be abortion or premature delivery can happen, even death of the neonate can happen. So these are the major complications. In immunocompromised patient, we definitely not, because their immunity on lower side, they can get infected early. Even if there is infection, definitely disease severity will be high in these cases. In complication like multi-organ dysfunction, ARDS, pneumonia, encephalitis, acute renal failure, these are all high in these immunocompromised patients, and definitely death rate is high. And normal death rate is around 1 to 3%, but it can be quite severe in these three categories: children, pregnant ladies, and immunocompromised patients. If we talk about the precaution, definite precaution is please avoid travel to the endemic country. And if you are traveling, take all the precautions. Do not have sex at unknown place. And if you are having any patient who is suffering from these symptoms, please avoid, and please follow all behaviors that can avoid from contacting such infection from such patients. Like you should all follow all the universal precautions. We saw like hand hygiene, masking, because we know this infection can be transmitted through droplet infections also, skin to skin contact also, and through sex. So these all three precautions we should take to avoid the infection. Even we all know that the small pox vaccine, it has been found in 1988 in a study that it can be around 85% protective. It can give protection to up to 85%. So those and countries where it is endemic or where now it is spreading very fast, I think close contact should be given vaccine as early as possible. We have already eradicated in smallpox in India. Definitely we don't have right now vaccine, but at least government should be prepared to deal any emergency such.